The number one health worry for women is breast cancer. But what women perhaps should be more concerned about is stroke. Strokes kill twice as many women as breast cancer every year. The risk factors for this cardiovascular syndrome can often go undetected until it's too late.
54-year-old Jane Mudgett of Tulsa is a successful financial planning specialist. In May of last year, Mudgett was sitting right here at her desk when she started feeling strange.
I started feeling very lightheaded. Something was not normal. It wasn't low blood sugar. It was just not feeling normal. And then in one eye, I was having vision problems. It looked like it was sort of a kaleidoscope in my eye, and then it happened in the other eye.
Mudgett called a doctor friend of hers and was told to immediately go to a hospital emergency room just a few blocks away. She was having what is called a TIA, or a mini stroke. Dr. Gregory Kogert of the Oklahoma Heart Institute at the Hillcrest Medical Center says Mudgett did the right thing.
Now, when it comes to symptoms of a stroke, time really matters because we need to treat signs of a stroke immediately to preserve the brain.
Dr. Kogert says people with high blood pressure, high cholesterol, and high blood sugar are most at risk for having a stroke. But Mudgett didn't fit the profile.
I have low blood pressure, I have low blood sugar, I have high cholesterol, but a great ratio. My HDL is 100. I'm in the top 1 percentile for the ratio.
But Dr. Kogert says another risk factor Mudgett has is the mere fact she is female.
Actually, being female is an independent risk factor for having a stroke. I think a lot of that has to do with the hormonal differences.
I'm an ovarian cancer survivor, and after that episode, we determined that I was at high risk for osteoporosis. So for osteoporosis, I was given hormone replacement therapy, which I had been on for 8 years.
It was determined that hormone replacement therapy triggered her mini stroke.
They advised me I take a full aspirin every day the rest of my life.
And that thins your blood?
It thins my blood. It thins my blood. And of course I was taken off of hormone replacement therapy.
Dr. Kogert says a woman's reproductive years also increase the risk of stroke.
Like the time around a pregnancy, the hormones tend to lead to blood clotting. Women that take birth control tend to be very specifically on a higher risk of having blood clots or having a stroke or really any kind of heart disease.
He says women may also have heart rhythm problems they aren't aware of.
AFib can present in any different way. Some people don't feel anything until they have a stroke. It's asymptomatic AFib can be the most dangerous.
Dr. Kogert explains a life-threatening stroke can happen when the heart is not beating properly.
Now the problem is by the top chamber not squeezing, the blood doesn't flow smoothly. Blood clots form if the blood is not flowing smoothly. And if a blood clot forms and breaks off, it can go to the brain and cause a stroke.
Dr. Kogert says if a stroke patient is treated early, clot-busting medication can be given to prevent bleeding in the brain. If AFib is detected before a stroke ever happens, blood thinners are often prescribed. Dr. Kogert says preventing a stroke is knowing your risk factors and doing something about them, like having a good diet and exercise to reduce blood pressure, cholesterol, and blood sugar.